Well, according to the CDC, about 700 women die in the U.S. each year because of pregnancy or its complications. Here in New Jersey, one group of women is seeing stark numbers when it comes to birth disparities. News 12 New Jersey's Naomi Yaneh is live tonight for us in New Brunswick with more. Tell us about this, Naomi.
Roxanne, in our state, Black women are 7 times more likely to die from pregnancy-related complications. And Black Maternal Health Week is an initiative that was started to help bring awareness to these numbers and to promote solutions to them as well.
Fortunately, I'm here.
Jacqueline Gilbert is one of the lucky ones who's still here and can share her story with other women.
I have toddler twins. They're going to be 4 in May. But I also had a miscarriage prior to my twins.
5 years ago, at 11 weeks pregnant, Jacqueline miscarried, and she said what several other Black women said they experienced when being treated: a lack of empathy and the feeling of not being heard.
I went for a second opinion, and that second doctor did not have any empathy. They were rushing the appointment. They checked the heartbeat really quickly.
Black women disproportionately lack necessary reproductive health care, leaving them vulnerable to pregnancy-related risk factors. When talking about morbidity and mortality, Black women are in the 40th percentile. Dr. Nicola Pemberton is the medical director at the Birth Center of New Jersey, and she hopes to be part of the solution.
There's a lot of situations out there where women are struggling with being able to have that kind of level of access, but we're trying to be that beacon and be able to give that access to and that education and ultimate empowerment to make better choices when it comes to preventative measures in pregnancy.
Earlier this year, the Nurture New Jersey Maternal and Infant Health Plan was launched by New Jersey's First Lady, Tammy Murphy. It's an initiative to reduce the state's high rates of maternal and infant mortality and an attempt to close the gap on racial disparities.
We shouldn't have to experience what so many Black women are experiencing. But if I didn't have health insurance, I would not have been able to go to those doctor's appointments 4 or 5 times a week, even if it is something that the high-risk doctor is recommending for the health of my children and for myself.
This should not be happening. So, Naomi, why are morbidity and mortality numbers for Black women so high?
So when I talked to Dr. Pemberton, she said it's hard to pinpoint just one factor, whether it be social, socioeconomic, or financial. But one common denominator she found among her patients coming to her from maybe other doctors was a common denominator was race-based bias from healthcare providers, whether that looks like not feeling heard or maybe a lack of advocacy from their healthcare providers.
Hopefully this story will even bring more of a light on this subject and really get some change going. Naomi Yaneh reporting live from New Brunswick. Thank you, Naomi.